Good afternoon. Thanks for joining us here today, and thank you to Dr. Brent Roussin for being here. And thank you, Brent, for all the work you're doing, and your dedication and commitment to the people of Manitoba is something we celebrate and appreciate, so thank you. This year's been like no other. COVID-19 has handed us some new challenges, to put it mildly, and even greater challenges than before. This virus has challenged each of us to become more resilient, more innovative, and more determined than we ever thought necessary. Our government's number one priority in the face of this pandemic has been to protect our most vulnerable citizens and ensure that our healthcare system is there for all Manitobans when they need it. Our COVID-19 case numbers are very concerning, to put it mildly. They continue to cause significant strain on our healthcare system. This is why 1 week ago, under the direction of Dr. Roussin and our healthcare leaders, we implemented new public health measures and moved all of Manitoba to critical or red on the pandemic response system in order to halt the spread of this virus and bend our COVID curve down. Those restrictions are now in place to significantly reduce gatherings, to limit social contacts and non-essential activities. However, despite those orders, which are the strongest in the country, and the firm recommendations from Dr. Roussin and our health system leaders, myself, our health minister, to stay home, some Manitobans and unfortunately some retailers as well are going against the spirit of those rules, and thus they are creating a greater risk to public safety. That is why today we are here to discuss new and stricter measures, including limiting residential gatherings to your household only, with exceptions for essential services, limiting retail operations with new capacity limits, and ensuring that only essential items are purchased in person, and providing clarity on what is deemed to be an essential item. I'll now pass it over to Dr. Roussin to provide his daily COVID update and to expand further on these new measures. Brent, over to you.
Thank you, Premier. Good afternoon. Today we are announcing 8 additional deaths due to COVID-19. A male in his 60s from the Winnipeg region, linked to the outbreak at the Kikinin Centre. A male in his 70s in the Winnipeg region, linked to the Maples long-term care home. A male in his 70s from Southern Health Santé Sud, linked to the Rest Haven nursing home. A female in her 80s from the Winnipeg region, linked to an outbreak at Maples long-term care. A male in his 80s from Southern Health Santé Sud, linked to an outbreak at Rest Haven nursing home. A female in her 90s from Winnipeg, linked to Maples long-term care home. A male in his 90s from Prairie Mountain Health region, linked to Gilbert Plains personal care home. A female in her 90s from Prairie Mountain Health, linked to Gilbert Plains. I'd like to extend my condolences to their families and loved ones. Our current 5-day COVID test positivity rate is 14%, provincially 13.7% in Winnipeg. We have 475 new cases of the virus identified as of 9:30 a.m., bringing our total to 12,482. Today we're announcing updated public health orders that will come into effect November 20. The orders will further limit social contacts and the operation of non-essential businesses. Last week we introduced the strictest public health orders we have had throughout this pandemic. We've pleaded with Manitobans to stay home, to protect themselves, protect their loved ones, protect the community. We advised strongly to only go to the store for absolute essentials. We pleaded with people to think about our healthcare providers that are at risk and how hospital capacity is becoming stretched. Despite that, we saw people gathering at rallies. We saw crowded parking lots at big box stores. We saw people continue to go out for non-essential items. So we're left with no choice but to announce further measures to protect Manitobans, to limit the spread of this virus. The new orders will state no one is permitted into a private residence or property other than those who live there, with a few exceptions for essential reasons such as childcare, health care, and emergencies. This includes your home, cottage, or other vacation property. If someone lives alone, they can have one other person into their residence, and they may visit that person's home as well. Gatherings of more than 5 people at any indoor and outdoor public place continue to be prohibited, of course with the exception of a healthcare facility, school, or critical businesses that are following the orders. Because the orders are strict, there's not really many indoor places where people can gather anymore. But it does allow instances such as weddings, funerals, other gatherings such as baptisms to take place, but that capacity limit is 5. We know there are significant physical and mental health benefits from being outside, staying active. The risk of contracting a virus is much lower outdoors. But even when observing the 5-person gathering limits for these specific situations, keep following basic public health advice, the fundamentals. We know there are many retailers out there that have been doing good work right from the beginning. They're following the orders, monitoring capacity, making the changes based on public health advice. But we saw others that were encouraging people to line up for Black Friday sales, selling non-essential items, trying to work around the orders. And so right now it's clear we need to reduce our contacts. We need to reduce prolonged close contact, especially indoors. And the best way to achieve that is to stay home. Stay home, don't socialize with people outside your household, and leave for essential reasons only. These new orders allow retail businesses to open only if they sell essential items, and they need to ensure compliance with capacity limits and implement physical distancing measures. Retailers can only sell essential items and must remove or limit access to or mark all non-essential items so they cannot be purchased. Retailers can continue to sell both essential and non-essential items online, by telephone, by delivery or pickup, curbside pickup. Retail restrictions apply to businesses not addressed in Schedule A of the public health orders. Those businesses continue to open and sell products as previously outlined in the orders. We're in a good position to make sure these orders are enforced. Increased enforcement measures have been introduced to uphold these public health orders. Provincial employees have been redeployed to enforcement, including police, environmental, and conservation officers, municipal bylaw officers. Almost 3,300 personnel across various enforcement agencies can enforce these orders. Manitobans can also report compliance issues to the tip line, manitoba.ca/COVID-19, or calling 204-945-3744, or 1-866-626-4862, that's toll free, and pressing option 3 on the menu. But we're asking Manitobans to hear these extremely strict restrictions and follow them without the threat of enforcement, right? These orders are really in place ultimately to save Manitoban lives. And so trying to work around these orders is defeating what the main purpose is: save Manitobans' lives. Listen to these clear directions. Immediately reduce your contacts in all non-essential outings. And we want to do this, of course, without the need for enforcement, but make no mistake, we'll definitely enforce if needed. We're at a very critical juncture right now. These restrictions are really designed to reduce the potential contacts for all Manitobans, therefore the potential of COVID-19 to spread. There's more details available on our website. We, of course, hope these won't be in place for long. We're going to leave them in for the least amount of time that we require. But we're critical right now with where our hospitals are at with capacity. We have to take these drastic measures to ensure our healthcare system is not overwhelmed. Right now, we've seen between 400 and almost 500 cases a day. We're reporting 8 and 12 deaths per day. We cannot allow these number of cases and deaths to become our norm. We have to be able to bend this curve down. And remind you that I'm in front of us mentioning numbers every day and providing my condolences. But it's got to be clear, these are not just numbers that I'm announcing every day. Right? These are people, these are Manitobans. These are brothers, sisters, parents, aunts. And every day we're listing more and more. So we cannot allow this to continue. We can't allow more people's loved ones to get sick, to die. So it's very clear that we can do this. Stay home, leave only for essential reasons, minimize our contacts. And that includes in-person Black Friday sales. We know what's needed to stop this spread. We can all take this action right now, today, to reduce our COVID numbers. So thanks to all Manitobans, and I'm going to pass it back to Premier.
Thanks again, Brent. This year's shown Manitoba and Manitobans at their finest, and we recognize the significant personal and professional sacrifices that all Manitobans have had to make in the face of this pandemic. But we've done that in order to protect ourselves, our loved ones, to protect our community. And I say to Manitobans, thank you to those of you who've been doing that, and to those of you who haven't, get on the team. Remember that the team is only as strong as its weakest link, and don't be the weakest link. Remember that the right to shop is not as important as the right to life. And we're bringing these difficult measures forward today to protect people and to save lives. And you have that power in your hands. So don't rush out to the stores and take advantage during the next few hours of the opportunity to hurt yourself and others. Please don't do that. And don't gather and protest without a mask on and endanger yourself and others. Do not do these things, because if you do, you will be ticketed and you will be fined. But more importantly, you will be placing yourself and others at risk. So I implore you, do the right thing. Get on the team. Manitoba's counting on you. Your friends, your neighbors, your loved ones are counting on you too. The new public health measures that were announced are being announced today and coming into force tomorrow at 12:01 a.m. require the cooperation and commitment of all Manitobans to make them work. Now, we all understand that the next few weeks are not going to be easy, but there is a reward waiting for us if we do the right things now. And I am confident that if we continue to work together, as most of us have done, we can get back to beating COVID-19. The best thing we can do for our local businesses who work so hard to provide the goods and services to us that they want to provide, to help them get back into business, is to beat COVID down. And we have to do that together. The best thing we can do to help our healthcare system is to do the same. To help our schools, to help our vulnerable communities, to help our loved ones, is flatten our COVID curve down. We did it once, we can do it again. And this is a team effort, and we need everyone on Team Manitoba. When we were abiding by the fundamentals, we were beating COVID. And some of us lost our way, and now COVID is beating us. And we need to get back to the fundamentals, and we need to bend that COVID curve down. Lorsque nous respections les fondamentaux, nous battions COVID. Alors certains d'entre nous ont perdu notre chemin. Et maintenant, COVID nous bat. Nous devons revenir aux fondamentaux et piller notre cœur COVID. It is crucial we follow those fundamentals. Stay home, only leave for essential purposes. Stay home when you're sick. Stay home if any member of your family is sick. Remember to wash your hands, cover your cough, practice physical distancing, wear a mask, limit your close contacts to only your household. And remember, shop local and shop online for a while. That's the way we go here in Manitoba. Thank you. Look forward to your questions.
Thank you, Mr. Premier. A reminder to our reporters on the line, you will have one preliminary and one follow-up question. Up first this afternoon from the Winnipeg Sun, Scott.
Hi, good afternoon. Scott Bill from Winnipeg Sun. First question for the Premier. Why did the Health Minister make a post yesterday suggesting that the COVID cases have plateaued in this province?
I think the important thing to understand here is we have restrictions we're bringing in today to make sure that the COVID case curve happens, and that we need to make it go down is essential. The desire of all of us is to do that, no one more than the Health Minister.
Okay. And with the new restrictions, I assume, with the last ones, people are going to look for ways around it. I imagine this time it's going to be the same. What is the message to those people now with these I guess, tighter restrictions, the tightest, whatever you want to call them?
I think that the overall intent of these orders is to reduce the amount of contacts, and the only purpose of these orders is to save Manitobans' lives. It's that simple. These orders are in place to save Manitobans' lives, and so people who are trying to find ways around these orders are undermining that very purpose. And that very purpose is to save Manitobans' lives.
From CBC Radio Canada, Emily.
Good afternoon. Quebec will reveal later today its plan for the holidays in terms of what kind of gatherings will be allowed and what won't. So you're now today announcing new restrictions that will go, I guess, until mid-December for now. But do you have anything planned already for the Christmas season, for the holiday season, especially for gatherings and for shopping?
Unless everybody gets with the team and gets on Team Manitoba, there isn't going to be much chance for us to change any of these restrictions. We're not going to be able to do that unless everybody gets on the team, and we limit the number of contacts for a time here, and we do the circuit breaker Dr. Roussin talked about. That's the goal. The goal here is to reduce those number of contacts down so much that when people get COVID, they haven't already given it to a bunch of other people. Brent?
Yep, correct. And it's just that's we know that the transmission takes place with that prolonged contact. And if we have people isolating, essentially, if somebody develops it, then they really have the inability to pass it on to someone else. And so what we'll do is we'll just see those numbers start dramatically coming down. And but it takes us all to take those steps.
Thank you. And another, just maybe one clarification. For example, when you talk about cottages and vacation rentals, if anyone is willing to, is renting out those kind of properties to only one family household, can they go still at the moment?
Well, the message right now is clear, right? It's stay home. That's our message. Non-essential travel. It's not what we need right now. So the message is clear, stay home. What the orders do is that if you did, say, rent out a cottage, that would be determined to be a residence. So only members of your household would be allowed to be in there. You couldn't rent it out with another household or have any visitors in there otherwise.
From CBC Manitoba, Bart.
Hi, Dr. Roussin. Could you, the rules that you told us earlier in the technical briefing, they're clear, but for the sake of anyone listening, can you please assure them that an individual, a vulnerable person living alone, will continue to be able to get the help that they need?
That's right. So we have to have exemptions in this order. So, households, it's socialization is really to zero in households, but the exemptions, home care, any other types of support, deliveries, maintenance, repairs, these are allowed. And in specifically those people living alone can still have that one person that they can still see and go see. We know how difficult this is, and you know, like we said, there's more aspects to health than just COVID. With this huge, the circuit breaker is required right now, but we have to have some of those exemptions to ensure people are able to get through this, what's going to be a challenging time.
Quick addition to that, Bart, would be also brief encounters at the door. If someone's bringing a delivery, of course, are okay, right, Brent? And also for seniors, for example, who want delivery from a grocery store of food and things like that, I would let them know if they need extra help with that, or that there's a help available with Help Next Door. It's a website that we have with volunteers available to assist them in that regard. So, and we might get snow here too, so if you need help with the walk getting shoveled, things like that, you don't need to go out and do it yourself and go to additional risk. We've got folks that are good-hearted Manitobans are ready to help you.
Thank you both very much for that. Dr. Roussin, with these restrictions in place starting tomorrow, when do you think we could see some effect on our indicator?
So when we start looking at, if we look at case numbers and test positivity, you know, within that 10-day period, we'll start seeing some benefits. Certainly at 14 days, you're going to start seeing some of that benefit. So we're just now creeping up to that from the initial red. And so we're looking very closely to see if we're going to start seeing a bit of a trend downwards in these numbers. Going weekend, we really would plan to see at least some sort of indication that these are providing benefit.
I'll add again, Bartley, and say 98% of people doing the right thing isn't enough now. We need everybody on the team. 2 people out of 100 doing the wrong thing can undermine the work that 98 other people did in this respect. So we need people to buy into these restrictions and make sure they're doing the right thing now.
From the Canadian Press, Steve.
Good afternoon. This order, as I see it, is in effect until December 11th. So for the next 3 weeks, there's restrictions on what goods can be purchased, at least in the store. Is there some flexibility, because you seem to have gone down a road now where the government is listing very detailed items in terms of what's essential and what's not? Will there be some revisiting if somebody says, well, wait a minute, you know, I'm out of adult T-shirts or sweaters or something?
Mm-hmm. Yeah, for sure. You know, we put these orders together. It's you know, it's an urgency to start getting on top of these numbers, and we take a lot of care to draft these orders. But right from the beginning, we've always continued to review them. We continue to meet with stakeholders, and so if there is anything further that we think would make the orders better, we'll certainly open to doing that.
I just say too, Steve, we all know there's no playbook here, and we can't let perfection be the enemy of protection right now.
Okay, and I noticed there's an exemption for people who live alone. So similar to the public health order in British Columbia, if somebody lives alone, despite the ban on having people over for social purposes, people who live alone are allowed to have one person over. Can you talk about the intent of that?
Yeah, and so it's exactly what we're saying is that you know, people who live alone could be even more vulnerable to the restrictions that we have here. We want to ensure that they have access to some of that ability to have face-to-face time with others, and we felt that having a designated one other person that they could do this with still meets the intent of the order, still dramatically decreasing people's contacts while still allowing them to have some of that connection.
From City News, Jonas.
Excuse me. Good afternoon, Dr. Roussin, Mr. Premier. Big changes here for business.
For folks that are listening in today and let's say they walk into a business tomorrow, it's going to look different than today. I guess, how should it look and what should they expect?
Yeah, and so what we really want to do is to ensure that it's clear to consumers what items are essential and what are not. And so at 12:01 tomorrow, non-essential items will no longer be able to be sold in any of these retail outlets. It will be Saturday, 12:01, that they would have to comply with the separating the non-essential goods. So we wanted to ensure that we had an appropriate time for businesses to be able to implement things like moving around their stores or roping off areas or proper signage. But yeah, it's come tomorrow. Somebody walking up to a till with a non-essential item is not going to be able to purchase that. And then come Saturday, it should be very clear to patrons what items are available for purchase and what items are not.
I think it's important to note too that to Manitobans, again, not to try gaming the system here, we're giving a little bit of time for the vast number of retailers that have done their very best to comply with the rules all the way along to do so. It's going to be a challenge for them to physically adjust their store space and shopping space so that the non-essential items are not a temptation to people coming in. But in the meantime, tomorrow, I just ask all Manitobans, don't go in and buy a head of lettuce and so you can get a color TV. That's not the deal. Don't do that. That'll be against the rules as of tomorrow. And for heaven's sakes, don't blame the teller when they don't ring it through, because they're not going to be able to ring it through anyway. So be respectful, don't game the system. The idea here is to put the right to life ahead of the right to shop. And we got to remember to do that because this is a real thing. We're talking about real people being impacted, and it's important that you do your part to help save lives now.
Thank you for that. And for businesses, this doesn't actually close a business. It just restricts their ability to sell non-essential items, correct? So, I mean, stores could be open with the owner and maybe an employee doing curbside pickup or delivery if needed.
Sure, online as well, of course, yeah. So those methods of being in the business continue, and although it poses a tremendous stress on all our affected businesses, it is important to understand as well that we're doing this for the right reasons and to do it. I would also emphasize to those small businesses that have had to shut down, that we have a new $5,000 bridge financing program. This is not a repayable loan. This is a grant program. So there is $5,000 available to you to help. I know that it's not going to make up for the hardships you're enduring. I know that. We all know that. But it is just an indication of our desire to help you through this time. And also, if we have to continue with these restrictions into the new year, there's another $5,000 available to those businesses impacted in this way. Also nonprofits, charities, and other organizations. So just put that plug in to you. If this is you, please make sure you apply so we can get that support to you.
From CHVN, Taylor.
Hi, good afternoon. Dr. Roussin, a lot of people have been following your recommendations, Latisse and SMART. Why should they be motivated to continue to follow these?
I'm sorry, there's a number of people who you mentioned have been following this, and why should they continue to follow?
Yeah, exactly.
Yeah, and I think it's definitely right. I think the majority of Manitobans have been stepping up right from the beginning, and I think they know very well they've stepped up because they know how important this is, and it's never been more important. Our numbers right now, our ICUs are getting full, our hospitals are getting full, so we're at that critical juncture. So all those people who have been complying all this time, it's thank you. You're helping people around you, but it's never been more critical for us to continue to follow these. Even though these are the most restrictive orders we've had in place, we're at the most critical time.
And those folks will have the satisfaction of knowing when we come through this together as Manitobans, they didn't kill somebody. They didn't cause tremendous hardship and hurt and misery for families. They didn't cause those problems to happen. That's a reason enough to do the right thing as far as I'm concerned, but we need every Manitoban to understand that now.
And for those who aren't on the team yet, do you think people now will begin to join? Is it too late to start?
Yeah, no, I mean, it's, we've always said it's like right now, like if you're concerned about COVID, you have options right now to protect yourself and protect people around you. And if you haven't been able to adhere at all or in complete fashion to the orders, now you can start today. It's never too late to get back on board, and everyone can do their part. And that's to just stay home, socialize only with members of your family, leave only for essential reasons, and we'll start seeing these numbers come down.
To those folks who are thinking of flaunting the rules at a protest on the weekend, for example, I would just simply say to them, how are you going to feel in a month from now when you find out that as a consequence of your being here, you got COVID and gave it to somebody else, some other innocent person, transferred it over to them? If you're taking personal responsibility for your own health, that's great, but understand the true impact here of other people, on other people, of your behavior is the consequences could be fatal. Understand that and do the right thing, and for heaven's sakes, don't show up at a maskless rally and try to think that your rights are more important than someone else's right to breathe, because they aren't.
From the Winnipeg Free Press, Tamer.
Good afternoon. My first question is for Dr. Roussin. Dr. Roussin, when looking at the test positivity rate in the province, which is at 14% today, what does this signal to you about our testing capacity and access and the effect of the pandemic restrictions in place so far? Do we need to open testing to more people to really understand the severity of community spread?
So, I mean, definitely the test positivity is too high. We can't sustain this. So are our absolute numbers. And so, you know, we're not turning people away at testing sites. We don't have those long lineups that we saw at the first bit. So I think that the testing capacity is still good. It's just that we have too much transmission of the virus right now. And so the effectiveness of the orders in place thus far, they may have been effective. We may have seen numbers much higher than this but for them, but they're certainly not taking us to where we need to be, and that's why we had to put these additional measures in.
My second question is for both of you. There's been some chatter about the kind of pressure that's led to these retail restrictions. Could you please tell us, Premier Pallister and Dr. Roussin, what kind of conversations led up to this, and how much of it was focused on the struggle for small business versus big box stores, that dilemma, and how much of it was based on public health considerations?
Yeah, I'd be glad to address that. Dr. Roussin and I and our leadership team work together on every single measure. We've done that since the beginning of the pandemic. We'll continue to do that, and I would emphasize we are united in fighting COVID. So I would emphasize to those who choose to try to put light between Dr. Roussin and I or anyone else in our leadership team that that's not helpful, and that type of divisiveness is counter to our focused need to work together to fight COVID. So my suggestion would be, if you like a hockey analogy, you think of me as Paul Maurice, the coach of the Jets, and you think of that man over there as Connor Hellebuck, and he's in the net, and he can only do the job with a team in front of him, back checking and blocking shots and playing defense, and that team is you. Whether in the media or in the general population for that matter, we need to play some team defense here, and then we need unity to do that. If it makes you feel better to blame somebody when the puck goes in the net, you can place the responsibility entirely on my shoulders. I'm fine with that. Don't pick on my goalie, okay, because I'm not pulling the goalie. This is the guy I trust, and this is the guy that's going to stay in charge. We're going to work together. And when we keep this COVID out of the net, that's a team accomplishment, and everybody can take the credit for that.
From Global, Alicia.
Good afternoon. Premier Pallister, some bigger businesses, they stand to lose hundreds of thousands of dollars in in-store sales, and some of them might think it's okay, or it might have the ability to swallow a $5,000 fine. So what are the consequences for selling non-essential goods, and could those consequences become tougher if big box stores decide to sell anyway?
Great point, because you're quite right in your preamble. Every big box organization and store has been notified. They are aware that there's enforcement officials there, and they're also aware that the consequences aren't just fines, they're closure. So don't think you can profit in the short term at the expense of putting lives at risk, and I don't believe that most of the big box stores would be irresponsible that way. But I most certainly can tell you that the enforcement and the consequences are far more severe than $5,000 if necessary. I hope it isn't necessary, but those penalties are very real.
Thank you. And Dr. Roussin, have COVID cases plateaued in Manitoba?
Well, what we see is in the last week or two, we're seeing the numbers at that 400 level, some above, some below. So we're not seeing the continued exponential growth. So it's hard to in epidemiologic terms say we've necessarily plateaued. We certainly haven't seen the exponential growth. So something's there that's prohibiting that at the time being. But even if we are at a plateau right now, we've plateaued at a level we can't sustain. Right, we have to bring these numbers down. We can't plateau at this level. So and so it just reinforces that we need these added orders in place. We have to shift things right now.
I'd say it's like
From the
I'd say,
Brandon Sun,
yeah.
Michelle.
Good afternoon. My first question is about the Reston school closure. It's been closed this week and it's supposed to be closed next week. It has numerous cases. It's under a code red. Can you confirm that is a transmission situation? And can you tell me if it is indicative of what's to come with schools, sort of a canary in the mine thing? Because people are already concerned and already asking why schools will remain open in light of these new restrictions.
Yeah, so Reston School, I don't have details on it. What we would say is that if we have cases in multiple cohorts, requiring multiple cohorts to self-isolate, then we'll often place that school into red and just have people on remote learning. We have seen very few examples of interfacility transmission in schools. We've seen lots of cases in school-age children, but despite that, not a lot of transmission within schools. So again, we're going to follow the epidemiology we see. We're going to make decisions balancing the effects of restrictions, and we all know there's quite a significant benefit to having in-class learning for kids. But if our epidemiology ever starts showing us that, in certain areas or overall we need to think about that, then we're always looking at that. But right now, we're just not seeing that transmission in schools.
Okay, thank you. And also, can you clarify for the public that some people do have medical exemptions and need them and should not be stigmatized? Because I have a gentleman here in Brandon who I'm writing a story with. He has severe asthma. He talks about being discriminated against. He's scared walking into a store. He's had threats that the RCMP would be called on him. He says, and to quote, "It's been very difficult and very dehumanizing, and my mental health has definitely suffered." So what do you have to say about this and to the public?
So there are exemptions to the requirements to wear masks, and some of them are medical conditions. I would say that the vast majority of Manitobans are able to wear a mask, and the exemptions don't include being uncomfortable or a nuisance. They are very specific exemptions. But it is absolutely true. There are some Manitobans that are unable to wear a mask. And the messaging that we've said, I think early on the first wave is be kind, right? Like we really are all in this together. And we've had episodes of groups being stigmatized right from the beginning. And we know that's what happens during, crises, is we look to stigmatize, we can look to be unkind to others, and that's not going to help us with COVID. So everyone do their part. There are some members of our province that are unable to wear masks, but no one should be entering into a crowded place. Everyone should be distanced, and everyone should be going out just for essential reasons right now. And so if we work together on that, we're going to start seeing these numbers come down.
From CJOB, Marnie.
Good afternoon, Dr. Roussin and Mr. Premier. I'm just wondering how office workplaces factor into this. In the spring, a lot of people were working remotely from home. A lot of those people have gone back into the office workspace. How does that factor into the 5-person limit?
Yeah, so businesses that are allowed to operate under Schedule A, so that's the sort of the critical businesses. The 5-person rules doesn't apply to them. Distancing does, but again, we have very high test positivity, and so when you have a high test positivity, that means it's increasing the likelihood that when you're in a group of people, someone in there is infectious. Right? The higher the test positivity, the more likely someone in that group is infectious. So we can't let our guards down. If you have people that can work from home reasonably, I'd suggest you do so. If not, then everyone needs to be practicing those fundamentals. Distancing, masks, hand sanitization whenever possible. Because that risk increases as we see a higher test positivity.
Thank you for that. And just going back to limiting contacts to household only, can you talk a little bit about how that will be enforced? You said you can't really obviously monitor every household. Is it just going to be done on kind of a report, or people who are calling in to report somebody that's having a gathering? How is that going to be enforced going forward?
We do have an activated tip line. We have had citizens calling on a regular basis now. Over 2,000-3,000 last weekend, for example, and we have, with the increased and beefed up enforcement, not only in the city of Winnipeg but around the province. We've had dozens of the rural municipalities use our provincial program to expand their force and to train and orient their force. So that is out there, but again, as Brent has said, and I would emphasize, there just aren't enough police in the world to help you do the right thing in this respect. Every household has to abide by these rules. We need everybody on side. Brent, you want to add?
Yeah, for sure. I think that's, it's that message exactly, is that enforcement of small groups in households difficult. It's certainly feasible. If we receive calls, or certainly larger groups, it's going to be enforced and can be enforced. But remember, these orders are for the sole purpose to save Manitobans' lives. And so anyone who's falling outside of these orders, you're undermining that very clear purpose of saving lives.
Our final reporter this afternoon from CTV, Jeff. Jeff from CTV. Thank you, Mr. Premier.
Thanks to everyone on the call. I wanted to offer an apology to our swim teams in the province. I had a report on Tuesday that a swim team had gone to Kenora for practice at their pool, and the report turned out to be false. And so I do not, in the spirit of Dr. Roussin's entreaty to be kind, the last thing I want to do is blame our great swim coaches and their teams for doing something they did not do. So I want to be very clear about that. It was a family that made the decision to go. It was a wrong decision. They've acknowledged that. But I want to say to Janet McMahon and the folks that support that sport and all are involved in it, and the coaches, that there was no intention to single you out, and I did it wrongly, and so for you, I apologize. That being said, I would ask everybody to remember that these measures are put in place to protect you. And please make sure you do everything that Dr. Roussin is asking you to do. The consequences if you do not are real and severe. Most importantly, you put yourself and others at risk. And so please do the right thing here. We can get through this together. Team Manitoba can win this thing. We can beat COVID, but we need everybody on the team. Thank you.